All right, now I got it. Good afternoon. We're going to go ahead and begin our Health Committee hearing. We're going to be starting as a subcommittee. As you see, we are a little short on members at this point. So we're going to be hearing Senate Bill 815. We'll be hearing 2 witnesses per side with a time limit of 3 minutes each. And we'll be asking each additional witnesses just to give their name and organization for the record and their position on the measure. So please come on forward. Thank you.
Make sure you had a
we can start.
Subcommittee. Thank you, Mr. Chair. Members,
Dr. Hernandez.
this bill, SB 815, is one of the 2 bills that would implement the state's Section 1115 Medi-Cal 2020 waiver. The other bill, AB 1568, by Assembly members Bonta and Atkins, we heard earlier, literally today, in the Health Committee, and they both got out with unanimous support. The waiver renewal is critical to the long-term financial stability of the Medi-Cal program. The waiver is estimated to bring down $6.2 billion in federal funds over 5 years. This bill establishes the statutory framework for the payments for public and district hospitals and the new global payment program for county hospitals and Medi-Cal managed care assessment. The Assembly companion bill contains the provisions establishing the whole person care and the dental transformation incentive program and the waiver required evaluations. There is an abundant amendment in this bill on data collection, on concentrating between public hospitals and Medi-Cal managed care plans, contracting that is, and that encourages contracting. We will take this in the Assembly appropriations, so we'll not slow down the bill today. And members, there's no opposition, and with that, I respectfully ask for an aye vote. I have individuals like to speak in support of the measure.
Thank you. Please go ahead.
Yes, Mr. Chair and members, thank you. Terry Thomas on behalf of the California Association of Public Hospitals and Health Systems. Our 21 public hospital healthcare systems perform the critical safety net role of delivering care of everyone regardless of ability to pay. We strongly support the renewed waiver, as we have testified previously before this committee. SB 815, as the Senator has indicated, now contains 2 of the 4 critical programs that are very essential for public hospitals. They're important both financially and for programmatic and healthcare delivery perspectives. The first program that it contains, the PRIME program, is a successor to what was called the DSRIP, the Delivery System Reform and Improvement Program, where we tried to make improvements in the delivery of care to patients. But this particular PRIME program is going to challenge public hospital systems to move even farther into system improvement for the benefit of patient care and greater efficiencies. It's a challenging pay-for-performance effort, first time in which public hospital systems must meet defined goals in terms of improved patient outcomes based on federal and state agreed-upon metrics in order to earn their prime dollars. If they do not meet those metrics, they will not earn their dollars. Again, it's very challenging, but the way our healthcare system is moving, and it has immense benefit for patients. The second component, the GPP, the Global Payment Program, also very important, and it stresses payment reforms to support better coordinated care for the remaining uninsured in California. By merging 2 prior funding sources, it will allow public health care systems to better align financing with care delivery. And in this program, we will be able to redirect some existing funds from payment programs to do things like moving away from paying for emergency room and inpatient care services to a redirection for lower cost and higher effective outpatient and primary care services. In this program, we can redirect some existing funds from the payment programs to do other things like telemedicine, et cetera, for the rural areas. We strongly support this bill, and we urge your aye vote.
Good afternoon. Catherine Austin Scott with the District Hospital Leadership Forum. I think Ms. Thomas did a fantastic job describing the PRIME and GPP. The district hospitals are frankly thrilled with this particular waiver. We've worked hard to make sure that the 2015-2016 waiver includes district hospitals so that it expands the scope of the waiver to our more rural hospitals who will benefit to the tune of about $100 million a year to meet those same goals as mentioned by Ms. Thomas, those same stretch goals. So we're thrilled to be supporting this particular waiver. We look forward to working with the department not only on the PRIME project, but on the other pieces as well, the whole person care, and in some areas we may get an opportunity to work on the dental as well, which this committee also saw before. So we ask for your support.
Thank you very much. Others in support?
Kelly Brooks on behalf of the California State Association of Counties, the Los Angeles County Board of Supervisors, the Santa Clara County Board of Supervisors, and the County Health Executives Association of California. All of the organizations are in strong support of this measure. Thank you.
Thank you.
Barbara Glazer with the California Hospital Association here today in support.
Great, thanks.
Angela Gilliard with University of California in support.
Thank you.
Amber King with the Association of California Healthcare Districts in support.
Mr. Chair and members, Elizabeth Landsberg with the Western Center on Law and Poverty. We're a little bit of a tweener. We very much support the bill moving forward. We recognize the critical role that public hospitals play in the system. We have requested a few amendments, which are duly noted in the analysis. This particular bill has three components of the waiver: the global payment program, the assessment, as well as prime. On the assessment of managed care access, we do hope that there will be a component specifically looking at access for rural folks and how long they're being made to travel to access specialty care. And then the analyses on both bills have reflected the concern about lack of access for Medi-Cal managed care members in going to the UC hospitals. We know it's a complicated issue that involves rates. We appreciate the conversations with the public hospitals and the UC hospitals in particular, but we do have considerable concerns about Medi-Cal beneficiaries not being able to access the UCs, and so appreciate the amendments on the reporting there and hope we can keep working on that issue. Urge your support.
Great.
Thank
Thank you very much. Anyone in opposition? Seeing none, we'll bring it back to the committee. Questions or comments from the committee? We can't move it, unfortunately. We don't have a quorum, so does anybody have a deck of cards?
Send out the cavalry, right?
No, can't quite do that. So, no questions or comments other than wanting to move a motion. We're close. We need we got 3, 6, 8 of us. We need two. We need 2 more.
Yeah.
We need 10. Yeah. So yes, Mr. Thurman. Oh, that'd be great.
How about I be your deck of cards and I'll ask a question? How about
That's
that?
right. That's all right.
I wanted to, through the chair, I wanted
Sure.
to ask the Senator a question. First of all, thank you for your leadership on addressing these issues and really supporting healthcare equity. Just wanted to, in a phrase, would you just share with us what we're trying to do here? It seems to me that this is really just technical and supporting what the waiver is trying to do. Just wanted to see if there are any other goals or objectives that you'd like us to be doing with this legislation.
Obviously, this is quite a bit of federal money that we want to bring down to the state. When we first initially requested it was significantly more. The federal government scaled it down, but there are some elements in here that were very, very important to, whether it's dental, whether it's whole patient care, whether it's, the hospitals. But the key is to get as many federal dollars as we possibly can to the most vulnerable communities, which are Medi-Cal population and the, rural, inner city, and where the greatest need is. That's just kind of it in a nutshell. I don't know if anybody else would like to comment on it as well.
Yeah, if I might, Mr. Thurmond, the waiver programs, which supplanted earlier payment sources for public hospitals, are really part of our core funding base. Without it, we would be extremely strapped. And in the old days, we used to just provide services and get paid for those services. But now, as part of the waiver, public hospitals will no longer be working in that environment. Now we have to demonstrate that we've not only provided the service, but we've improved the health status or care or reduced unnecessary falls or what any of these number of metrics are in the PRIME program in order to get our money. That's part of the pay for performance. And in the global payment system, which is also a core funding base for public hospitals, we are being loosened from some strings, you might say, about how we provide care to the remaining uninsured. We no longer have to follow these narrow, rigid guidelines about how to provide the care if it's not in the appropriate place or, it's allowing us to use, like I said, telemedicine or something like that. So it's changing the whole way we're delivering care to our patients to not only be more efficient, but to improve their health status.
Thank you.
Assemblymember Santiago is really getting out of control over here.
I notice he's banging on the walls over there. I'm a little concerned.
He can't wait to move this. He just wants to implement this.
We can't move anything until we take. Well, we'll take roll first. I'm going to torture Mr. Santiago just a little bit.
If I could, Mr. Chair, I was just going to say that I appreciate that we have an opportunity to get some money.
Yes.
In an era where we're seeing fewer and fewer dollars for public hospitals, we appreciate you clarifying the urgency and the opportunity, and that there's innovation involved here to help our hospitals. So thank you for your leadership.
Well, I appreciate it. If you think about, it's 1/3 of the population of the Medi-Cal, it's the most vulnerable population, and I'm assuming and I hope there's going to be bipartisan support, just like there was on the MCO bill, which drew down additional federal dollars to help us supplement that population, is very, very important. So appreciate it. Thank you.
Well said. As soon as we have quorum, I'd be happy to second Ms. Burke's motion. Second.
Well, how about we take roll, then we'll go through all that. But first of all, thank you, Senator Hernandez, for bringing the bill forward, and thank you to the witnesses. There is no doubt how critically important this is to all of us. So we'll go ahead and ask for the Secretary to take the roll.
Wood.
Here.
Mainshine. Bonilla. Here. Burke. Here. Campos. Chu. Gomez. Hernandez. Lackey.
Here. Just kidding. I'm kidding. You said Hernandez. I said here. I shouldn't joke like that.
Yeah, that's right.
And Nazarian.
Done that.
Yeah.
Olson.
Here.
Patterson. Here. Ridley Thomas. Rodriguez.
Here.
Santiago.
Here.
Steinnorth.
Here.
Thurmond.
Here.
Waldron.
Here.
Okay.
We have a quorum. We have a motion by Ms. Burke, a second by Mr. Thurmond, and we'll ask for the Secretary to call the roll.
It's due past due appropriations.
And this is due past to appropriations, and there was an amendment.
To be taken in
To be taken in appropriations. Thank you. Okay. All right.
Wood.
Yes. Aye.
Wood, aye. Mainshine. Bonilla.
Aye.
Burke.
Aye.
I'm sorry. Bonilla, aye. Burke, aye. Campos. Chu. Gomez. Assemblymember Hernandez.
I can't vote for this one?
Lackey. Aye. Lackey, aye. Nazarian. Olson.
Aye.
Olson, aye. Patterson. Aye. Patterson, aye. Ridley Thomas. Rodriguez. Aye. Rodriguez, aye. Santiago. Aye. Santiago, aye. Steinnorth. Aye. Steinnorth, aye. Thurmond. Aye. Thurmond, aye. Waldron. Aye. Waldron, aye. 11-0.
The vote is 11-0. The bill is on its way to appropriations. Thank you, Dr.
Thank you,
Hernandez.
Mr. Chairman and members. Appreciate it.
Thank you very much.
Appreciate it.
We're going to keep the roll open for a few minutes for other members to come and add on.
Any other votes besides just this? Oh, this is it. That one? I thought it was two. No, just this. Okay.